right, everybody, Dr. Rayfitch here from Vet Triage. We are starting a brand new journal today, JAVMA, January 1st, 2016, and we're going to be talking about a bird. It is a what is your diagnosis section of JAVMA. There it is, there's a birdie. And so the study comes out of the zoo in Ohio. These are left lateral and ventral dorsal radiographs of a 4.5-year-old double-barred finch, also known as Poephila bichenovii, evaluated for poor flight and a pasty vent, poor muscle mass, a doughy coelom, and a urate-covered vent. On physical examination, coelomic palpation, which is the abdomen, expressed an abnormally large amount of droppings. They tried treating the bird with fluids, vitamin B, and dextrose. Then they started enrofloxacin and meloxicam for suspected egg yolk soleomitis or colomitis. The radiographs show here, severe ill-defined punctate osteolysis of the keel, which is a large arrow, so the keel is the sternum. That's that portion here, so there's that. Gas distended loop of intestine in the caudal-coelomic cavity, which is a small arrow, so right here, distension here of the intestine. Osteoproliferative mass involving the coccygeal vertebrae, sclerosis of the coracoids, and multifocal endosteal sclerotic foci in the humeri, ulnae, femur, and tibiotarsal. So all the bones are very dense, and then there's a mass right here. There you go. Here's the mass, dense bones. And by the way, they say here femurs, but I think it's femora, which is the plural for femur. So radiographic findings and interpretation. They also is loss of the cardiohepatic silhouette, consistent with hepatomegaly or a coelomic mass displacing the liver. The radiographic diagnosis is mixed polyostotic sclerosis and lysis, lack of coelomic detail, possible hepatomegaly, and intestinal ileus. Differential diagnoses include disseminated bacterial or mycotic osteomyelitis and hepatitis, may be caused by Mycobacterium avium. Cancer, hepatic lipidosis, coelomic effusion, fat atrophy, coelomic mass, enteritis, or intestinal obstruction. Let's go over a few things here. So when they say here cardiohepatic silhouette, that implies the merging of the heart and the liver. And the reason why those two organs merge is because birds do not have a diaphragm, and so the heart and the liver on x-rays look like they're silhouetting, so they look the same. They look like they're conjoined rather. When we talk about polyostotic sclerosis and lysis, so polyostotic means affecting more than one bone as opposed to monostotic. And then sclerosis is hardening of the bone, so usually due to increased mineral density. What else can I tell you here? Oh, and the coelomic cavity is the abdominal cavity. They call it that way in reptiles and birds because of their embryology is different than in mammals. All right, treatment and outcome. They did necropsy and found granulomatous encephalitis with numerous non-acid-fast coccylobacilli, granulomatous osteomyelitis, interstitial nephritis, subacute necrosis, fat atrophy in the mesentery and bone marrow, chronic proventriculitis. The sclerotic foci in the long bones were likely additional foci of infection. There was no growth on aerobic bacterial culture, and the final diagnosis was bacterial osteomyelitis with secondary encephalitis. So let's talk about these terms. Granulomatous implies chronicity typically, and usually when you think of granulomatous reactions, you think of macrophages or monocytes, but usually macrophages, because those are monocytes that went from the periphery into tissues and then became macrophages. Encephalitis is inflammation of the brain. Osteomyelitis is inflammation of the bone. That's a common misconception. people hear osteomyelitis and they think automatically infection of the bone, but actually osteomyelitis literally means inflammation of the bone, which could be due to infection, and most often is, but it's not the only thing that causes osteomyelitis. Interstitial nephritis means inflammation in the kidneys within the interstitium, so not in the capsule, but in the parenchyma. The fat atrophy in the mesenteric bone marrow could explain why the bone marrow, while the bone on radiographs were sclerotic, because if the bone marrow is lost, and the fat in the bones are lost, and the bone looks more hardened on X-rays. And then proventriculitis, that's inflammation of one of the gastrointestinal organs in birds. All right, comments. Bacteria isolated from birds with osteomyelitis are ubiquitous and opportunistic avian pathogens. So ubiquitous means that it's everywhere in the environment. Opportunistic means that these are normally not pathogenic bacteria until they have an opportunity to become so, then they take advantage of it. So for example, if all of a sudden your immune system declines, then that means that opportunistic bacteria are now welcome to do their thing and cause infection and inflammation. So differentials include Mycobacterium subspecies, Staphylococcus aureus, E. coli or Escherichia coli, Salmonella species, Pasteurella metacida, Streptococcus species, Enterococcus species, Pseudomonas species, and Aeromonas species. In birds, salmonellosis, caused by Salmonella, has been associated with brain abscesses, meningitis, osteomyelitis, tenosynovitis, arthritis. Pasteurellosis has been shown to cause neurologic disease, uncoordinated flight. Mycobacterium, including Mycobacterium avium intracellular complex, are endemic worldwide. Endemic means that it's stable in the population, it's constantly there. Endemic worldwide, stable in the environment, and difficult to eradicate. Mycobacteriosis can cause 3 syndromes: classic tuberculosis, paratuberculosis, and atypical or diffuse mycobacteriosis, in which granulomatous lesions are not present. Osteomyelitis occurs in up to 93% of avian mycobacteriosis cases. Radiographic lesions of mycobacteriosis include osteolysis, sclerosis, or cystic lesions associated with the mid-shaft region of long bones, ribs, or sternum. Mucormycosis, caused by either Ipsidia species, Rhizopus species, and Mucor species, has been reported to cause fungal osteomyelitis in birds, but is rare. On X-rays, fungal osteomyelitis causes a periosteal reaction or increased medullary opacity. Although not common, osteosarcoma has been reported in long bones of birds. Chondrosarcoma, which occurs across joint spaces, has been rarely reported. Others include multiple myeloma, osteoma, but they have not been reported in avian species. That's it. Pretty interesting case in a bird. So not much else to say there. We'll see you guys again in the next video. Take care.